Hello, everyone. In this unit, we're going to talk about the intersection of psychology and health and the concept of well being. So, what is health? When we hear a word like health, we often think about whether someone has a cold or the flu, or they have a chronic condition like something like diabetes. And this view fits the kind of traditional Western model of medicine, which defines health as simply being the absence of disease. In this model, patients are kind of a passive recipient of care, and the treatments typically focus on fixing a problem. Often, they want to give you a medication or they do a surgery or something like that. The doctor is the expert, and the patient is then supposed to follow the orders of the doctor. But there's been a growing shift toward a more integrated approach to health and the concept of well being, which views patients as being kind of an active participant. And this approach recognizes that our attitudes and behaviors, things like how we manage stress, what our exercise habits are, or even how optimistic we are, can influence not just recovery, but also our ability to thrive. If you think of two patients recovering from surgery, and one just kind of passively follows instructions, but is pessimistic and isolated, while the other one is proactive and they ask lots of questions. They have social support, and they maintain a hopeful mindset. Well, the research will show that that second person is probably more likely to recover more quickly and return to a higher quality of life. And so this is what is kind of studied in the area of health psychology. So, health psychology is a subfield of psychology that explores how psychological factors, your thoughts, your emotions, your behaviors, interact with physical health. So, health psychologists not only study illness, but they look at how to promote well being to help prevent disease. Um, well being in this context isn't just about kind of like feeling okay physically, but it also includes concepts like life satisfaction or emotional balance and functioning well in daily life. So, health psychology kind of goes beyond the idea of like just fixing whatever's broken and focuses on helping people to flourish. So, a health psychologist might be the type of person who designs a program to help people quit smoking, and not just by giving them nicotine patches, but looking at why do they smoke. Maybe they need to teach them stress management, or boost self-efficacy, or figure out some way to like restructure negative thinking that helps prevent future relapses. So one way to help us understand like what makes healthy people, or people be healthy, or sick or what have you, is that we need to consider more than just simply, um, you know, germs that cause diseases, or genetics that might cause a problem. And so this is the idea of kind of the biosocial model. And that offers a more complete picture of looking at people's health. It looks at biological factors, so things like genetics and immune function and what have you. But it also looks at psychological factors, so mood, personality, coping skills. And it also looks at social factors, so relationships, the culture that you're in. All these things go together. So this, using this model, you can kind of understand why two people with the same diagnosis might have different outcomes depending on how they think or behave, or interact with their environment. So you could, like, two people who have high blood pressure, and one person eats poorly, is constantly stressed, and has few social connections, while the other person has a support group of friends, and They maybe do something like they meditate daily, and they regularly exercise. And so regardless of that, the biology or the medications might be the same, the long-term health outcomes of the first person will probably, or excuse me, uh, I forgot which one I just said. The person who meditates in, I guess that was the second person I said, is likely going to be, better than the person who's stressed and eats poorly. So when social psychologists, excuse me, I'm sorry, when health psychologists are looking at these things, there's a lot of different types of health concerns that exist out there that have strong behavioral components to it. And so it's important to remember, our behaviors are deeply linked to our health. And so things like obesity or things like sexually transmitted infections, or why people smoke, or even more positive things like why people do or do not exercise. These things aren't just medical issues. A doctor tells you you should exercise more, you need to quit smoking. Um, it's more than just something that you can prescribe. There is a behavioral and psychological aspect of these things. And so one area that we're going to kind of focus on talking about in this unit is the concept of stress. So what is stress? So it's more than just a feeling. It's a mental, physical, and behavioral response to events we perceive as being challenging or threatening. And so you can have a stressor, which is anything in the environment that threatens our well-being. And we then can have a stress response, which is our body's physiological changes or emotional reactions and behaviors in response to that stressor. Now, stress isn't always harmful. There can be mediating factors that then determine how we respond. These can be things like personality traits, coping strategies, social support, and they can actually shape whether a stress actually harms us, or in some cases can actually motivate us. So let's talk a moment about kind of the biology of stress. When a person is experiencing stress, there's kind of two main types of systems in the body that we often think of as being associated with the response to stress. Um, so one of these is known as the HPA axis, which stands for the hypothalamic pituitary adrenal axis, the HPA axis. So in this, you have when stress is perceived, the hypothalamus in the brain releases a hormone known as corticotropin releasing factor that travels to the pituitary gland. Then this triggers the release in the pituitary gland of adrenocorticotropic hormone, or ACTH. That then travels in the blood system down to your adrenal glands, which are located near your kidneys. And this causes the release of several hormones, but the main one that we associate with stress is called cortisol. There is another stress response mechanism, which is your sympathetic nervous system. And so your sympathetic nervous system, if you remember from the beginning of the semester, is our fight or flight system. And with this, you have areas in especially like the brainstem areas, that then trigger the release of epinephrine, which is also known as adrenaline. So this cortisol and adrenaline are two of the main stress-related hormones associated with the release. Is released when we have stress. Now, interestingly, there's, while we generally think of stress as being a negative, there are actually two main types of stress. We can have distress, negative stress. You get fired from your job. You have an illness. These are negative stressors. But there's also the idea of eustress, this stress of positive events. You just got a new job, like that is stressful, but yet it is a good kind of stress. Um, and so when looking at these types of stress, we have to consider that there are kind of degrees to this. So some stressors are those that are major life stressors. They're related to things that are large events in our life. So, a couple gets a divorce. You have to move across country. A death of a loved one. All these kind of things are things that like disrupt nearly every aspect of your life. But stress is also not just these big things. We also have more common things that we can call daily hassles. And this is, being stuck in traffic, or you left your lunch that you're trying to bring your lunch to work and you left it at home, and now you can't figure out where to go eat. Or so these are things that are daily irritations, but don't have the quite the same large scale effect on your life. So stress can have an impact on our immune system. So the immune system is that which defends us from pathogen. Um, and so it's how we deal with germs and viruses, bacteria, allergens, or what have you. So interestingly, short bursts of stress can actually boost immune function, which kind of makes sense if you think about how our biology is set up. That if you need, stress is designed to help us to survive something, acute, immediate stress. So we have something, and our body rallies resources that to allow us to get through that in order to survive. And so in that sense, you want your body to be kind of in peak condition. This includes having a strong immune system. However, chronic stress, so stress that carries on, that lasts for a while, this can be damaging to our immune system. It suppresses immune function, and it makes us more vulnerable to illnesses. You can see that like caregivers for chronically ill family members will show a weakened immune response, including slower wound healing and increased susceptibility to things like colds and flu compared to non-caregivers. So the chronic stress of having to take care of somebody can actually then make you then more likely to get sick. So a guy named Hans Seil developed this research around looking at how the immune system was impacted with stress, and developed this kind of typical pattern that's seen responding to stress, known as they call the general adaptation syndrome. And there's kind of three stages to it. So initially, you have the alarm stage. And so this is the body's immediate reaction to a stressful event. And so you have your adrenaline and your cortisol, they're surging, your heart's going, you have this fight or flight response. You have these things that help you to get through the immediacy of this stressful event. However, you then will go into the second stage, which is resistance. And so this is where the initial shock of the stressful event, is kind of worn off, and now your body is trying to cope with what you're doing. And so this, you might feel like that you're managing, but your stress hormones are still remaining elevated during this time. But eventually, if this lasts long enough, then you enter into the third stage, which is exhaustion, where you're just no longer able to adapt to the stress that you're dealing with. The prolonged stress wears you down. You're fatigued and irritable, and you're at a greater risk at this point of illness. So stress is also related to heart disease. So while genetics plays a big role in heart disease, how we respond to stress is also really important. And so there's research that has shown that there are these behavior patterns that can predict your kind of susceptibility to heart disease. And so one of these is known as a type A behavior or personality. So these are personality traits that are characterized by being very competitive. You're very achievement oriented. You can be aggressive or hostile. They're very impatient and just generally unable to just relax. And people who have this type A behavior pattern, especially looking at men, are more likely to develop heart disease. On the other side, you can have type B personality patterns, which is a personality trait that's characterized by being, not very competitive, more relaxed, more easygoing, and more accommodating. And these individuals then would have less of a risk of heart disease. Then you have hostile personality. So this is kind of going beyond a type A. Being generally hostile is a powerful, kind of indicator of potential of heart disease. People who are angry, combative, cynical tend to have these higher rates of cardiovascular problems and even early death. And these are also another thing to consider is that regardless of whether a person is type A or type B or what have you, but people who have negative emotional states, especially when we talk about depression, also can predict more likely to have heart disease.